What's the best, longest lasting treatment for sagging eyelids and crow's feet? One of my eyelids is sagging lower than the other. I have noticeable wrinkles around my eyes and lines starting to form on my cheeks when I smile.
Thank you for your question. You've submitted your question without a photo, but you're asking what is the best long-lasting treatment to help sagging eyelids and crow's feet lines. And you elaborate further in your question that you notice that one eye is more droopy than the other, and that you're noticing crow's feet lines that are extending into the cheeks. Well, I can certainly share with you my general approach that hopefully will be useful to you when you decide to meet with doctors about your situation. A little bit of background, I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, helping people with drooping eyelids and crow's feet lines and eye and facial aesthetics, particularly in the arena of facial aging, has been a core of my practice for over 20 years. So when I look at a patient who complains have similar situations like what you're describing, I do the following. I look at things in a systematic way. First, when you say one eye is drooping more than the other, you want to distinguish, is there excess skin, and that term is called dermatochalasis, or is there ptosis? Ptosis, which means drooping of the eyelid margin, which means the relative position of the eyelid to the center of the pupil is lower, or is it a combination of both? So a proper eye evaluation will determine whether there is excess skin or drooping of the eyelid, dermatochalasis versus ptosis. It's also important to look at the eyebrow position. The eyebrow can descend with age, and often there is a certain contribution of that extra skin or drooping from the eyebrow. So that's just one part of the upper eyelid question. When it comes to the procedure that's longest lasting, you're basically talking about a procedure such as cosmetic upper eyelid blepharoplasty. Cosmetic upper eyelid blepharoplasty means that essentially what we're doing is we're artfully creating a natural shape that involves removal of extra skin and soft tissue, as well as possibly fat that is contributing to that drooping, heavy appearance. If there is the presence of ptosis, well, that's a little bit more technically demanding. This is a procedure called ptosis repair, where the muscle that lifts the eyelid, called the levator muscle, is addressed, and the eyelid is allowed to open further. And again, I can't overstate it because it's frequently missed, that you have to be able to identify and distinguish what is causing the drooping of the eyelid. There are times when patients come who have had upper eyelid blepharoplasty and they still feel like their eyes aren't that open, and it's because they have ptosis. So not missing ptosis is very important. The art of upper eyelid surgery is that it should look very, very nice and natural. And I think a lot of people are very afraid of an over-operated look. And this speaks to really the individual style of the doctor you choose. And therefore it's important to look at that doctor's before and afters to get a sense of what their style is. In my own personal approach is I like to retain a character to the person's face. And so when I do upper eyelid blepharoplasty, my goal is to really show off the patient's natural eye shape. It's not about just removal of extra skin. We've had patients come who were very unhappy with eyelid surgery done elsewhere because they had the skin removed, but the true shape of their eye and the character of their shape now is not the same as what they had hoped it would be. And basically they don't feel like they're looking at themselves, and they're very uncomfortable with that. So good planning and an artistic approach is very important. Now, this surgery is done in our practice under local anesthesia with light sedation. This means that you're not put under general anesthesia. It's done in our office operating facility, which a lot of patients find attractive because they don't have to go to a hospital or surgery center. And most people go back to work in a week. Now, as far as the question of crow's feet lines, it's a different type of strategy in terms of, quote, long lasting. When you look at crow's feet lines, you have to think of two different variables. One is the activity, which means do the crow's feet lines, how much are they pronounced when you smile, when you're active, and these are called dynamic wrinkles. And then there is the lines that they're at rest, and those are called static wrinkles. Well, there's usually a dual approach in our practice. What I do is I recommend a neurotoxin such as Botox or Dysport to relax those muscles, and that can last anywhere from 3 to 6 months, so there isn't this constant compression. And in certain candidates, we can consider everything from lasers to radiofrequency, as well as platelet-rich plasma derived from your own blood to stimulate collagen, softer fillers. There are definitely a lot of ways to treat the static lines, the lines that are there at rest. And that combination is usually very, very successful. But in terms of long lasting, there's always some kind of maintenance involved, because really what you're dealing with is a dynamic process. Muscles moving, normal facial aging, and you're dealing with skin quality. So typically a patient will come in for Botox every 4 months or so. They'll come in for PRP injections once every 6 months. As far as the lasers are concerned, usually one laser is good for many years, but it depends on the type of lasers. There's a lot of different options. There's non-ablative, there's ablative. And so this is a more individualized, and that's based on a physical examination. So I recommend you meet with qualified, experienced cosmetic surgeons who work extensively in the eye area, look at their results, look at their style, and see if you are able to click and work well with the doctor that you meet with. So I hope that was helpful. I wish you the best of luck. Thank you for your question.